I've been a veterinarian for 25 years. And so I've seen a lot of my community, like in the hospital, as we sit there, judge pet parents, especially if the pet parent elects euthanasia for behavior reasons or sometimes for medical reasons, if the veterinary healthcare team member deems it to be too early, right? And
Mhm.
so what I've said for many, many years to my team is no problem. Put the dog or cat in the back of your SUV. You think it's too early, put them in your car and you take them home. Otherwise, zip it. But I'm
Yeah.
sure that you, as a veterinary social worker, have a nicer, a kinder way to speak to your team members. How do we deal with this? Because even like maybe I don't judge 99% of my clients, even I am going to go in there sometimes and go, dang it, why don't you just try? Just try. So, how do we honor that, but also let go of it? How does this work?
The judgment is anger and frustration and again helplessness, right? Because when you're in that position, especially in our current country, pets are property, right? So even with your expertise as a veterinarian or a veterinary professional, you can't say this is what you should do with this pet, right? And even though maybe you would want to put it in your car, or maybe you can't, but I think the judgment ultimately is coming from the feelings, and so it's a lot easier to displace those and say, well, I'm mad at this person for this decision, rather than turning inward to say, why am I so uncomfortable with this? I know this patient, I know this client, I know they have been trying really hard. And again, we really only ever know the tip of the iceberg, right? We don't know everything else going on in that client's life that is making uh, them move towards this decision. So I think the reframe for me is always, why are you judging them so hard? Because usually that's something that's going on. Is this bringing up feelings of a decision you had to make? And so rather than processing that, you're just going to get mad at someone else. Um, so I think it's a time for introspection. And again, yes, you can say if you feel like rehoming is an option, if you feel like this, yes, giving them the options, but it's their choice. It is their animal at the end of the day. And so do you want to be a supporter to the humans during the most difficult day for them? Or are you going to be the one that they remember was giving them the side eye and was very short and made their hardest day even harder? And that's your choice, being part of that team in that clinic. And what do you want to be remembered as? I think is also a way that you could present that as well.
Yeah. What do you want to be remembered as? Yep. Sometimes I say, if this was your last day, how would you behave? Because sometimes I find myself behaving in ways that I'm thinking, if this was my last day, I'd be ashamed of myself, right? Like, yeah, yeah.